Life is weird.
Super weird.
So, what did we decide to do with our fascination for the strange and unusual?
We made a podcast about it. This is Weirdify. Now,
let's get weird. So now we're live?
Now we're live.
Okay, that is wonderful news.
Yes.
Welcome to episode 3.
Episode 3 of Weirdify. Episode 3.
I just wanted to start singing.
I'm gonna say it again. 3 is the
Three in a
magic
family.
number.
Three in a family.
No, it's the second time we're singing a song that's not our own song. I don't.
That's all right.
Hi.
Hi. How are you?
I'm well. How are you?
I'm all right.
Good.
Hanging in there.
Yeah.
You know, living life. It's treating me well.
Yep.
Yeah. I'm excited to talk to you about a disease.
Me too.
I'm
Well-
very mine's not really a disease. It kind of is, but it isn't.
Mine kind of is and kind of isn't too, though.
Okay.
So I think we're okay.
That's good. It's like, it's just in like that realm,
Yeah.
you know?
Yeah. Okay. Feel free to go whenever you'd like to.
Okay.
I'm ready.
You're ready?
Yeah.
Right now? Already?
I don't think I'm
Okay.
going to be as sweaty
That's good.
this episode, nor do I think I'm going to talk about it as much. And I'm
Well-
also,
I'm sure our listeners will appreciate that.
yeah, I'm sure they will. I am drinking, I actually just finished lemonade and now I'm drinking water. So,
So that's Haley's menu for this evening.
yeah, no White Claws because
That's a bummer.
there will be other episodes where I
That's
will
true.
be White Clawing
That's true.
hard. Not as hard because your girl was feeling it, but anyway.
It was a good episode to feel it, though.
It was a good. I don't know if I would have been able to get through it without
Yes, you would
some White Claws. I
Yes,
don't
you
know.
would
I was
have.
very
I
scared.
can't believe you, of all people, you're my ghosty friend. You're the one that listens to all the ghost podcast.
Podcast?
You're the one that listens to the ghost podcast.
I know, but
And you're like all into that.
I know.
I can't
it was,
believe it.
it was really scary. I probably because I wasn't. I just didn't know. I think the whole not knowing what you were gonna do,
Yeah.
and it just like was multiple story. It was like multiple story after multiple story after multiple story, and it just kept. It was like a very bad snowball.
Yeah.
And just kept getting bigger and bigger, and it just wouldn't stop.
Seems like, well, we're taking it down a notch.
Yeah,
this
we
week.
are taking it down a notch. We're talking about some weird diseases, or
Ish.
I guess our case, maybe
Something
diseases,
in the
non-disease.
weird medical realm, I guess.
Yeah. So, whenever you're ready, take it away. I'm
All right.
super stoked.
Okay. I am doing Alice in Wonderland syndrome.
I almost did this. I almost did this.
Really?
Yes. I absolutely almost did. And then I was like, oh my God, it'd be so cute because it's Amanda and it's Alice in Wonderland. And then I was like, I actually didn't even think. I was like, maybe she picked this. I honestly, yeah. Anyway, okay.
I did pick it, and I'm going to tell you all
No, I
about
know,
it.
but-
Did you look into it?
A smidge.
Okay.
But
Okay.
it didn't grab me.
No worries.
So I'm very excited to hear
Oh,
more.
good. I'm so glad. Okay, well, I'm very excited to tell you. So, Alice in Wonderland syndrome, it's basically something that affects your senses. So, you have these like episodes, and it can affect all different kinds of senses. So, it can affect sight and your sense of time. It's crazy. So, I'll tell you about all of the symptoms and everything, but basically, like, you'll see things incorrectly. And often symptoms will begin at the onset of a migraine, during a migraine, or after a migraine. And some people think that it's a subtype of migraine, even though people, like, it doesn't necessarily, it's not painful. Mm-hmm. It's just like this specific thing that happens.
Right.
It's also referred to as AWS or AIWS.
Oh, AW. Okay. Got it.
Yeah, okay.
Sorry, I thought it was just like AWS only. No A. Anyway. Sorry.
It's just Wonderland syndrome, right? Is that what you're saying?
Yeah.
Okay. No, Alice is in there. She's included in it.
Okay.
So AIWS or AWS affects usually children and young adults. It can affect you into adulthood, but generally you kind of like have a few episodes and then kind of grow out of it. Mm-hmm. Why are you smiling?
I'm
like
sorry. No, I'm just thinking
Why?
I'm just thinking about how I legitimately looked at this and I didn't even like cross my mind. I was like, oh my God, I wonder if this is hers. My brain went in a whole other direction as to what you possibly could have picked. So, but it's all good.
this? I love it. I love it. Okay. So episodes can typically last a few minutes. One place I read said they could last a few days, which is crazy.
That's
Oh my
unfortunate.
God. But most everywhere said maybe like up to half an hour. You can have like one a day or several a day in a week, and then like not have any for weeks or months. They're like totally unpredictable. Okay, so these are some of the symptoms, and I have like names and then definitions because there's several things there's a lot of different things that you can experience that fall under the category of Alice in Wonderland syndrome. Okay, so symptoms include body parts looking bigger, smaller, farther away, or closer than they are. So you'll experience, and I'm not sure if I'm pronouncing all of these right, so I'm just really going to go for it, okay? These are all like visual distortions that you'll experience or you can experience.
Okay.
So micropsia or micropsia, when objects are perceived to be smaller than they are. Macropsia, when objects around you are growing larger. Pelopsia, when objects appear nearer than they actually are. Telopsia, when objects appear much farther away than they are. Zoopsia? I don't know.
Zoopsia?
I'm going with zoopsia. A form of hallucination in which the sufferer imagines they see animals or like swarms of little animals, or you'll see groups of large animals. So I'm thinking like cockroaches or like mice.
No.
Or like,
Too close
I don't
to
know, like
home.
a gazelle. Oh, sorry. Yeah, true. That's true.
Oh, no.
Haley currently has a mice situation.
I do
she's
have
dealing
a
with.
mouse situation. The pest
It's
guy,
too soon.
yeah, the pest guy came today and set down a trap, and literally within 15 minutes of him leaving, I heard a squeak, and I about died.
I'm
Yeah.
sorry.
So I'm gonna go with like little like squirrels. I'm going with like groups of squirrels.
Okay.
Is what people are hallucinating seeing.
Yeah, and they're singing.
Yeah, absolutely.
Choreographed.
Going on the Alice in Wonderland theme. Maybe some rocking horseflies.
Yeah. Oh, maybe some like little oysters.
Some mome rats.
Little swarm of oysters. Oh my gosh. Okay, so we're gonna picture little oysters.
Little oysters.
Little mome
Little
rats. Okay,
oysters.
love. Or you could see groups of large animals. So I don't know.
I went to
like
Bambi. I just imagined a bunch of groups, like a bunch of deer.
deer. Yeah, I love that. Okay, cool.
Happy.
So
All
yeah,
happy.
so you can hallucinate animals.
Okay.
Zoopsia. So I think I did
Zoopsia.
pronounce that right because we're talking about animals,
Is it
right?
Z-O-O?
Yeah.
Oh, okay. Then yeah, probably.
Another symptom that you can experience is faces can be distorted.
Nope.
Yeah, I know. I know. This is like, so I'm like reading through this, like, wow, that's crazy. Oh my gosh. But what's crazy is that people actually experience this, like things, you'll be looking at something and it's just like growing. Okay.
Thank you. And this is happening, well, you'll probably get to causes. Okay. Then I'll
Yeah.
putting a pin in that.
So inanimate objects can move or like look like they're moving, or like lines on the wall or something, or like if you're looking at tile or something, the lines can just literally look like they're moving. Feeling like you're tilting. Loss of a sense of time, like it's going slower or faster than it really is.
I experience that every day.
From 8:30 to 5. No, I'm just kidding. Yeah, for sure. Even sounds can seem louder than they really are. People have also reported having trouble walking or feeling like you have no control of your limbs.
Oh my gosh, that's what happens to me in every single nightmare.
Oh God.
I get up to stand and to run, and my legs stop working, and I'm just like dragging them on the ground. And I'm always being chased by something. That, and then my teeth are always falling out in my nightmares.
Oh.
Yeah, I don't know what that means. If anyone knows, tell me.
When I'm having a nightmare that I need like help, or like would need to be able to run or something, I always can't talk.
Oh, like you open your mouth and you
And
can't
just nothing
even.
comes out.
Oh no!
I had a dream like years ago, and I was in like a neighbor's garage, but not a neighbor that I knew. Just like in my dream, it was my neighbor, and so everything made sense. But he was like, I don't really remember. Maybe he was like pervy. I'm not sure. But I wanted my dad, and I was like scared, and I needed help, and so I was trying to scream "Dad," and it was just, and like nothing would come out, and this guy was like gonna kill me or hurt me or something like that.
Oh, that's terrifying.
Yeah, but I've had like dreams like that where I need something or like I need help.
Yeah,
and
it's just
nothing
not coming out. Ooh, that sucks.
My recurring dream is always like rear-ending a car. Like
After
I'm
your
always
accident
like
or before?
like slamming on my brakes.
Is that after your accident or before?
Oh no, my whole life.
Your whole life. Oh, interesting.
Yeah. Okay. Anyways. Back to our regularly scheduled. A few other just kind of like random things you can experience is nausea, dizziness, agitation, and paranoia. So there's causes are different, but not completely confirmed. So there are some things that seem to cause Alice in Wonderland syndrome or seem to trigger these effects, but there's really nothing confirmed. Mm-hmm. Okay, so some of these can be migraines, like I mentioned earlier, or when people have certain types of infections. Some of those infections include the influenza A virus, scarlet fever, and tonsillaryngitis, or Epstein-Barr virus. Those are 3 particular sicknesses or viruses that you can have that people often experience this syndrome while having. Epileptic seizures, head trauma, brain tumors, using LSD or marijuana, decreased blood flow to certain areas of the brain is a simpler way of saying it than a lot of the medical terms I didn't understand. Certain over-the-counter drugs can make these episodes occur also, like some cough syrups and allergy medications. There is no proven effective treatment. So that's unfortunate.
That sucks.
Yeah. So it's just kind of they don't necessarily know what brings them on, and then they don't necessarily know how to make them stop. There are some things that seem to help lessen symptoms, though. Some antidepressants, blood pressure medicines are some of the things that doctors might prescribe you to reduce your symptoms. And then basically avoiding anything that triggers your symptoms. So if you do something that triggers your migraines and then that sets off episodes, not that anybody would, that's kind of where your mind would go, is to obviously reduce anything that's going to give you those symptoms.
Right.
But
yeah.
I read that several places. So Dr. Grant Liu, a pediatric neuro-ophthalmologist at the Children's Hospital of Philadelphia, studied, interviewed, and examined 48 patients, which I realize is not a very big pool, but all of these patients that had the syndrome as a child between the years of 93 and 2013. 13% of the cases were traced to some sort of infection, 6% to migraine, and another 6% to head trauma. In about half of the cases, though, there was no cause found. 40% still experience symptoms. Some people stated that after they started experiencing episodes, they started getting migraines. So they started experiencing some of those symptoms, and then they started getting migraines.
Would the migraines make them worse? So
No, it's just they'd never had a history of migraines before, and then they started getting some of any of those symptoms.
And then they were happening regularly for them? Oh, I see.
In the study, Dr. Grant Liu indicated that it may be more widespread because a lot of the family members didn't admit to having any types of symptoms. Basically, people, he feels like people are kind of embarrassed of it, or if you experience, one of those symptoms or something, you might be am I going crazy? If, the cup on the table is 4 times bigger than it's supposed to be, you might not think you need medical attention,
Yeah.
You might just be am I tripping? What the heck is going on? I mean, maybe if you're on LSD, that would make sense, but if you're just, some people have no causes, so.
Yeah.
Alice in Wonderland syndrome is another name for Todd syndrome because in 1955, he wrote a paper and it was basically first identified.
Sorry, that's the year that Disneyland opened. I'm just bringing it back around.
That's great. Oh my gosh.
Okay, sorry,
okay.
continue.
So it was identified in a 1955 paper that he wrote. He was a British psychiatrist at Reynolds Royds Hospital at Menston in West Yorkshire. Wow. I'm almost done. Thank God. For fuck's sake. Oh, man. I feel like we should leave in at least some of these bloopers.
Yeah, we'll listen to it.
There's
and we'll
too
figure it
many.
out, yeah.
I'm really,
It's pretty rich.
The specifics of his writing resembled that of Lewis Carroll's novel Alice in Wonderland. It's obviously not that hard to figure out why he would feel like it resembled that.
Right.
From all the similarities in the book, Todd actually speculated that Carroll may have experienced many of these symptoms, inspiring the famous novel that he wrote.
Oh, interesting.
And that's what
Versus
I have.
what everyone thinks was that he was tripping hard, right?
Yeah.
Yeah.
Or maybe he just
Or maybe he was, but it wasn't in the way that they thought. Oh, interesting. That's a very interesting twist.
Yeah. Bring it back around.
Bringing it back around. All right. So I do want to give a little bit of a trigger warning for mine.
Oh, wow. Okay.
Only because I do talk about mental health, like a lot of elements having to do with mental health and mental illness and certain types of therapy and treatments for that.
Okay.
I do also want to say that people very close to me suffer from mental illness, and I'm an advocate absolutely for mental health. So I don't want, and this is just research that I got. It isn't necessarily, I just don't, I want to be respectful. Okay. I try to be as respectful as possible. So yeah, just so you know, this does discuss a lot of things regarding mental illness. Okay, so my disease is called the Cotard Delusion, or the Cotard Delusion.
Okay. Oh, I've never heard of this. Very excited.
It is also known as walking corpse syndrome. It is a rare condition where a person holds the belief that they or their body parts are dead, dying, or don't exist, and they feel as though they are dead, rotting away, or never existed.
Oh.
Some feel this way about their entire body, and others only feel it in regards to specific limbs, organs, or in some cases, their soul. I don't know. Anyway, we'll edit that out.
Okay.
In 1880, French neurologist Jules Cotard described the condition as the delirium of negation.
Okay.
And this was illustrated in a strange case that he called Mademoiselle X, where he studied a woman who had denied the existence of her brain, heart, stomach, and intestines. The woman was convinced that she was condemned to eternal damnation and could not die from a natural death.
Oh my gosh.
Since she was suffering under this delirium, she did eventually die due to starvation caused by her delusion because she believed that she didn't have a stomach, intestines, anything. So she just she denied her need to eat.
Wow. That's...
yeah, pretty gnarly.
That's wild.
Pretty gnarly.
Sorry, there's
okay.
music in the background. I live in a noisy neighborhood.
Oh.
We've done
I thought you were talking to me, and I was like, oh, God, what did I do?
We've done everything we can to eliminate as much of the background noise of my neighborhood as we can, but
truly
it is
the noisiest
inevitable.
neighborhood in America.
We will work on the sound. Bear with us. Sorry to interrupt you, Haley, but I just want to say we realize that there's probably music you can hear in the background. There's probably dogs barking. Sorry.
Yeah.
We're working on sound. Bear with us.
It's trial and error.
As
we're doing what we can
journey.
with what we got.
Yes, exactly. Okay, please continue.
No problem. Cotard syndrome can accompany other mental illnesses and neurological conditions, but it does most often occur with severe depression and some psychotic disorders. One of the main symptoms is nihilism, which is the belief that nothing has any value or meaning, hence why it's often closely related with depression.
Okay.
A 2011 review of existing Cotard's delusion research stated that 89% of the documented cases included depression as a symptom. Other symptoms include anxiety, hallucinations, and hypochondria, the central symptom being the delusions of negation, where the patient will deny their own existence, the existence of a body part, the existence of another person, or sometimes even the existence of the entire world.
What?
Yeah,
That's
it was
okay,
big.
wow.
I had never heard of this, and so I dove more into it, and I was like, whoa.
Wow, that's wild.
Trippy.
So you can go from like, I don't think my pinky is here to like, I don't think the world is here.
Yeah, I mean,
But
just
then what are
depending
you
on the
doing? Are you
severity
just
of
in,
it.
like, black. I mean, how do you not? What are you
don't know.
seeing then? I wonder.
So I'll get into that a little bit.
Okay. Oh yeah.
Cotard's delusion exists in 3 stages. The first is the germination stage, which is where the symptoms of depressive psychosis and hypochondria occur. The blooming stage, which is full development of the syndrome and delusions of negation of self, which prevent patients from making sense of their external reality, which then produces a distortion of the external world, similar to those delusions found in cases of schizophrenia. However, hallucinations are not required for a diagnosis of Cotard's syndrome.
Okay,
or
they're
Cotard's
just
delusion.
like common.
Yeah.
Okay.
The third stage is the chronic stage, which is where increased severe delusions occur accompanied by quote-unquote psychiatric depression. Researchers are not sure what specifically causes Cotard's delusion, but there are a few possible factors. Studies show that the average age of those affected by the delusion is 50, but there were also stories, and it can also occur in children and teenagers.
Okay.
Healthline website states that people under the age of 25 with Cotard delusion tend to also have bipolar depression, and that women also seem more likely to develop the delusion than men.
Okay.
I put one of those faces with like the unimpressed faces with like the
Mm-hmm. Oh, yeah. Okay. Yes.
like in my little notes, and
Got it.
like, I just thought that was, I was like, of course it's women.
Of course. Yeah, always. We get that shit in quite a bit.
Yeah. It has been found in patients suffering from clinical depression, brain tumors, and severe migraines. It's said that it is often associated with lesions on the parietal lobe of the brain. Diagnosing Cotard's delusion is difficult since it's most often not recognized as a disease, which means that there is no standardized criteria to make an actual diagnosis.
Oh, man, that's like mine.
Yeah, and it's most often diagnosed after other possible conditions have already been ruled out. So it's pretty much completely up to clinical interpretation.
Wow, that's crazy.
I know. Scrolling back up the page. Boop, bitty boop, boop. The underlying cause of Cotard syndrome is most likely neurological. It is thought to be caused by a misfiring between the fusiform of the brain, which is what recognizes faces, and the amygdala. I don't know why I'm trying to sound like super smart, but I'm just hoping I'm pronouncing everything.
First of all,
right.
it's okay. When I was looking up mine, I mean, there's a lot of big medical terms.
Yeah.
It makes me have a lot of respect.
Yeah, and I would
don't respect my mom, but it makes me have more respect for
I
her
would
as a
open
nurse.
every single thing to be like, okay, well, what's this? I'm like, oh, okay, just so I was a little bit more educated, because this is such a
It was like a rabbit hole each time.
Yeah, it's
too.
such a touchy and like sensitive topic for so many people, and so I was like,
Absolutely.
okay, I want to do it justice, and I don't want to sound like a total asshat.
Oh, yeah, you're
Yeah.
sweet, Haley.
So,
Well, I don't think you sound like an asshat, just to clarify.
oh, thank you.
I think you're great.
It's thought to be caused by a misfiring between the fusiform of the brain, which recognizes faces, and the amygdala, which is what associates emotion to a recognized face.
Got it.
This misfire then results in a disconnection from one's environment. This is similar to another phenomena called the Capgras delusion, where a similar misfire happens so that when the patient sees a familiar face, they view them as an imposter.
Oh, okay. That's like kind of like dementia or something like that too, in a sense. Or like where you don't recognize faces, or no, this is different.
I think certain types of dementia,
Okay.
like or certain levels, I should say, not types, but
Gotcha.
I think some are more intense where they don't recognize faces, or they like recognize that it's someone they know, but they don't believe that they exist.
Gotcha. Okay.
The Cotard delusion focuses more on when a patient sees their own face and have no association with their face and sense of self, therefore leading them to believe that they don't exist.
Okay. Wow.
Cotard's delusion is often
So deep.
I know. I had to
Oh my
reread
gosh.
a lot of this a lot of times because it was a mental workout.
Yeah.
Between like all the really long words that I haven't even really got to yet, but it was just a lot. It was a lot of medical terms, and again, I wanted to do it justice.
Yeah, of course.
Cotard's delusion is often associated with lesions on the, I think I said this, lesions on the parietal lobe of the brain. It can also be a result of a patient's adverse reaction to the high serum concentration of CMMG. Here's one of the really complicated words. Carboxymethylguanine, or guanine.
Okay.
But otherwise, CMMG is what it's shortened as.
Gotcha.
Which is a principal component of ACV, which is acyclovir, which is an antiviral medication to help assist with, obviously herpes can't be healed, but assisting with like lessening herpes, as well as helping cure chickenpox and shingles.
Gotcha.
As far as treatment, patients are... Oh, here's my other trigger warning for treatments. It's fairly short, but just so you know. As far as treatments, patients are often prescribed antidepressants, antipsychotics, and mood stabilizers to help. And I did read that they will often also use electroshock therapy. Cases are... There was a few. There wasn't really that many. But one was, there was a patient that was diagnosed as having Cotard's delusion after a traumatic brain injury. And after he had MRIs, the patient was discharged in January of 1990 He was scheduled to travel with his mom, but had kept experiencing visual difficulty, which led to them taking him back to the hospital for another assessment, and they found further damage. For months after the initial trauma, he had experienced difficulty recognizing faces, places, and objects. He was also convinced that he was dead and had died from either AIDS or sepsis.
Whoa.
And had gone to hell.
Oh my gosh. Well, I mean, it's not that great here.
And, well, yeah. After a bit of neurological testing, he was no longer convinced that he was dead, but he did still suspect that he was.
Okay.
He just was no
He's
longer
like,
convinced.
I'm not convinced I totally am, but like, I still might be.
Yeah, he was
Okay,
still a
wow,
skeptic that
crazy.
he wasn't.
Okay.
After he was treated for depression, though, his delusions had diminished. Another one was in 2008. A 53-year-old woman had complained that she was dead and smelt like rotting flesh.
Oh my gosh.
She had even asked her family to take her to a morgue so she could be with other dead people.
Oh my god. What?
Yeah.
Okay.
Instead, they called 911, and when the paramedics arrived and picked her up, she claimed that they were trying to burn her house down. Again, after psychiatric care, she was released with significant improvement.
Wow.
And then the last story that I had was a 46-year-old woman had claimed that she had not eaten or gone to the bathroom in months or slept in years. She claimed that her organs had rotted and that she had no blood, and that the doctors were all lying when they took her blood pressure and monitored her heartbeat. Yeah. Again, with the proper treatment, she was released and everything significantly improved.
Okay.
And that was one thing that I had found, was with the proper treatment, or once it was diagnosed as quote unquote depression or something, and they were able to actively treat it, people got significantly better. So the guy that thought that he was like in hell, I think within the year he was pretty much completely.
He really was.
Yeah.
Yeah.
So anyway, that's Cotard, the Cotard delusion, or walking corpse syndrome.
That's fucking insane.
I know.
That's crazy.
I know.
That's like mind blowing.
Yeah.
Wow.
Yeah, it wasn't.
Interesting that both of ours is seeing things.
Yeah.
That are not, or feeling
that are
things,
there, or like yeah, you're
time
seeing
or
it, but you're not
sound.
registering. Like I'm looking at you, but I'm thinking you're an imposter. I'm like, no, Amanda's not real. Like this isn't Amanda.
Or I'm looking at you and you're like super teeny.
Oh yeah.
Little alien.
Yeah, we did. You were going through your story, and there were some similarities. And I was like, oh, it's really interesting. A lot of similarities.
Cool.
But
well,
man,
that was fascinating.
Yeah, those were good. Originally, I was going to do, you probably saw it because it was on the same list as the Alice in Wonderland syndrome, was the foreign language syndrome. Did you see that? Oh, so it's the same thing, head trauma or pretty much something of that nature. Mm-hmm. And they'll start speaking in a different accent. Like people from certain parts of England would be, and you know how like in England there's so many different types of dialects, just like there is in the United States. They'd be talking in a whole different dialect, or like someone from England would all of a sudden take on an American New York accent. Or like it was just super weird. And they wouldn't be able to speak a language fluently. It was just an accent, but they will have like never been to the place where they would have picked it up.
That sounds like that episode from Radio Rental where that guy turns into like a Russian guy. Do you remember that episode?
Vaguely.
And he like comes back from a trip to Russia and he's Russian.
Yeah.
I mean, and he speaks fluent Russian.
Yeah.
And he's
they thought it was like his doppelganger or his twin or something.
And he's like eating Russian food.
Or he was like hypnotized.
Yeah.
Ooh, yeah, I forgot about that one. Ooh, that one was creepy.
Yeah, it was. Yeah. But that's a great podcast.
It is a great podcast.
Yeah. Well, that was fun. Thanks for bringing that to the table.
Yeah, of course.
Yeah. Well, should we close it out?
Yeah, we can close it out. If you so fancy following us on
Instagram
at Weirdify Podcast.
You can email us at... Why do we struggle with this?
I have no idea.
It's great. Oh my God.
We'll find the groove.
Weirdifypodcast@gmail.com.
Weirdifypodcast@gmail.com. Or if you want to find out a little bit more about us, or I don't know, whatever, you can head over to our website, which is www.weirdifypodcast.com.
That's the one.
Is that the one?
.com.
.com.
And send us your emails. We want to know if there's weird stories about you. Do you have a strange disease?
Yeah, do you have a strange...
Or do you know of somebody who did?
Yeah, and we have nothing... we say strange or weird disease, but we don't. That's not necessarily a bad thing. Like, if anything, just like this.
We don't mean it offensive.
Yeah, we don't mean it offensively. We just want to. We want to be knowledgeable. Mm-hmm. We want, teach us something that we may not know.
Yeah, definitely. Absolutely.
So yeah.
And we can get to know you.
Exactly.
So we want to hear your strange, weird, odd stories.
Yeah.
So send them in.
Yeah, absolutely.
Weirdifypodcast@gmail.com.
Yep. We're really good at saying that now.
What's that?
I said we're really good at saying that now.
Hey, man. We're going to have to be professionals eventually.
Yeah, eventually.
Maybe not, actually.
We'll see when and if that day happens.
Oh, man. Well, until next time.
Remember?
Keep it weird.